Well, the National Union of Public Service and Allied Workers plans to shut down a Dischem warehouse following multiple positive COVID-19 cases. Now, the union says there have been 10 positive COVID-19 cases at the pharmaceuticals warehouse across a number of departments, and it claims the company has not carried out adequate screening and tracing processes. However, Dischem says it has adhered to all requirements throughout the lockdown period. Let's chat now to Dischem CEO Ivan Saltzman for more on that. Ivan, a very good morning. Thanks for your time. So let's get some response to what the union is alleging, saying that when these 10 cases were discovered, I think it was about a week ago, that it was business as usual at that warehouse. I'd like your response to that, please.
That's totally untrue. It started off with one person being tested positive. The warehouse was closed, desanitized, and the people around and the area around the positive person was desanitized. We tested 58 people and 8 were positive. And until the results came, the 58 were in quarantine, and after we found out who was negative, the negative people came back to work. The other 8 are at home in quarantine.
All right, so just for clarity, you say that the warehouse was closed and you did the whole sanitizing. For how long was it closed? Because according to them, it didn't seem like the warehouse had been shut down at all.
It was closed overnight.
All right, so in terms of your screening process as well, they allege that you had not carried out adequate screening and tracing processes. Would you say that you had, that your screening of employees every day, them coming into the warehouse, and then also when it comes to tracing who had been in contact with them, do you think that was adequately done?
Well, employees are screened 3 times before they enter the warehouse. Once at the biometric system, and another time when they clock in, or we don't clock in anymore, but when they walk into the warehouse, and the 3rd time as they enter the warehouse.
All right, well, Ivan, we are looking at a warehouse. I mean, we're not looking at just a tiny office or, just a couple of floors of an office. You've got a warehouse, I would imagine. It is huge. You've got a lot of merchandise in there, a lot of product as well. Do you think that closing it just overnight and sanitizing would have been enough, that was adequate and would have made it safe for others to return?
That is all that is required. It's definitely adequate. We follow all the rules. The Department of Environmental Affairs has been there. On the weekend, the whole warehouse, including the areas where the non-infected people were found, was also sanitized.
And would you say that you successfully managed to track and trace every other employee that had come into contact with them? Well,
that's not entirely possible, but definitely the people that were in the work area or traveled with the people that were infected were all tested.
All right, and in terms of the merchandise that they would have come into contact to, my understanding is that this would be a distribution point. Your stuff would go to Dischem's all over Gauteng or in the region. What have you done on that front to make sure that that all of that was clean and sanitized before it got to the general public?
Well, the whole warehouse is sanitized. The virus does not live longer than a day or a night. And it's like everywhere else in any other store.
But in terms of what might have left your warehouse before you became aware of the positive cases?
No, I don't understand the question. The whole warehouse was fogged.
Yes, no, I mean, you discovered that these employees were positive, but obviously they have come into contact with merchandise before you had. It might have been a couple of days before. Stuff might have left already in the run-up to you finding out that they were positive. Is there a need to recall some of these?
No, not at all. That's not that would serve no purpose. COVID-19 is rife throughout the whole of South Africa. We have how many cases? 45,000. Wherever the 45,000 people have been, I doubt whether their steps have been retraced and everything that they could have come into contact.
Well, we have we have over 70,000 cases at the moment, but I don't think that that's a good enough explanation. I mean, you've got merchandise that has left. It's going to come into the hands of the general public. You have a responsibility to make sure, and I'm sure that you are able to track or trace whatever has left your warehouse in that time for safety purposes for the general public. They're going to Dischem stores thinking that, you know, taking all the precautions that they are taking, and it doesn't seem like you've taken this seriously enough.
You know, I think you're really on the wrong track. Everything comes in outer cases, everything is palletized, everything is wrapped before it leaves. And there is no human contact once it leaves until it arrives.
All right, well, I don't know your process in the warehouse as well. I'm not sure, but I would imagine that there should be some concern over, because somebody somewhere had to stack those, had to pack them at some point before you say there was no human contact. But in terms of the employees having to pay 500 Rand for their own tests, is that true?
Totally untrue. We do offer COVID testing. If an employee is, our employees that show symptoms are obviously tested free of charge. If any of the public or anyone that shows no symptoms and has no reason except that they want to reassure themselves needs testing, then obviously they pay like anybody else.
All right, so those who showed symptoms were given their test free of charge, and those who wanted to be tested or thought they needed to be, then they were asked to pay 500 Rand for those tests.
No, not you. You're not saying well what I said. I said that those that are in contact and are deemed to be necessary are tested free of charge.
Okay, all right. Well, I'm a bit concerned as a member of the public, as a consumer, Ivan, that if I walk into a Dischem, I'm not sure what has come from your warehouse, what these positive employees may have come into contact with. We don't know the nature of this virus. I would want, as a consumer, I would expect that maybe you would keep, a closer eye on those things, that you would be able to track, trace them, bring them back to your warehouse.
Are you blaming us for spreading the virus?
I'm not blaming you for spreading the virus, but I would think that you might have a responsibility, because everybody seems to be doing their best to make sure that we don't spread it. But knowing that you might have had product that these positive employees may have come into contact with before they got to the stores, I would, as a consumer, would have imagined that you would maybe bring back whatever had left your warehouse at that time and make sure that the right things were done, or done in store at least.
Everybody wears masks. All protocol is followed. Hands are washed. Every employee is tested. It is not possible, and it is not done anywhere, for merchandise to be returned.
Okay, well, Ivan, I want your assurance that if I were to go into a Dischem today and I were to buy something, I should not have to worry about picking up the virus from something that has left a warehouse where people have actually tested positive for COVID-19. Can you give us that assurance at this point?
Absolutely. You're not more at risk than going anywhere else.
All right, we'll leave it there for now. Thank you very much, Dischem CEO Ivan Salzman there, just explaining to us about the situation at the Dischem warehouse. It is worrying, but he stands his ground on that one. Well, more news.